Hi and welcome back to the channel. Today we're going to talk about what it's like to work in a COVID vaccination centre and also what the experience as a patient is like. So I've been working at a COVID vaccination centre since December, and I thought I'd give you a little bit of an insight about what it's like to work there. I thought I'd start by telling you what my first impressions of working there were. And I have to say, it's one of the most efficient setups that I've seen in the NHS. As a GP, I'm used to working in the NHS, and I know how slow and sluggish it can sometimes be when changes need to be made. But I've been astounded at how efficiently we've put together these vaccination centres and how well they're run. And the second thing, I was reminded of how gracious our patients are. Not just for vaccinations, but for other care that they've received. I think it's fair to say that no one in the NHS asks for much. We're certainly not asking for any claps. But it's nice to receive some positive feedback after what's been a difficult year. And the third thing is, and I have to say one of the best things about working in the NHS, is the teamwork. We have such a wide range of skilled individuals working here, from practice managers, nurses, HCAs, pharmacists, GPs, not to mention all of the awesome volunteers who come from a range of different backgrounds that have given up their time to make sure that everything runs really smoothly. It's just a really warm and positive environment, and it's really been enjoyable to work there. So now I'll talk about what it's like as a patient when you're going into a vaccination centre. Now bear in mind that each vaccination centre works slightly differently, but I'll talk about the process at the two vaccination centres that I've worked at. As you enter, you'll be given a paper form and asked to fill in some of your details, so things like your name, your date of birth, your NHS number if you know it, and things like your next of kin's details as well. You'll then be given a seat to wait, usually just for a few minutes, before you're called to a table where one of the healthcare professionals will be giving you a vaccination. They'll talk you through what to expect and answer any questions that you have. At this point, you'll be asked a few questions just to check in case you have any contraindications to receiving the vaccination. So I'll talk you through some of these questions now. They include if you're on certain medications, such as blood thinners. This can include things like warfarin, apixaban, rivaroxaban. If you are taking these, it doesn't mean that you can't have the vaccination, but there might be a few things that they have to bear in mind, so they'll talk you through that at the time. So you'll be asked whether you have any symptoms of COVID, so things like a cough, fever, or loss of your sense of smell. If you do have these symptoms, you wouldn't be able to have the vaccination at this point. They'll also ask if you've had COVID in the past 30 days. If you have, then you would need to again postpone this until later. They'll also ask if you've had any other vaccines in the past 7 days. If you have, again, you'll need to postpone the vaccination. They'll also check at this time whether you're pregnant. If you are, you may still be able to have the vaccination, but it's worth checking with your midwife or your GP beforehand to see if that would be suitable for you. The other important question is whether you've had any allergies to any medications in the past. Again, that doesn't necessarily mean that you can't have this vaccination. There's only very specific allergies that we get particularly concerned about, and you can ask them at the time. They'll also ask if you've ever had an anaphylactic reaction to anything before, so it's important that you tell them if this has been the case. So with these particular contraindications, like I said, it doesn't necessarily exclude you from having the vaccination, but they'll give you specific advice at the time. At present, there are 3 vaccinations that are being offered in the UK. There's the Pfizer vaccination, the AstraZeneca vaccination, and, starting this month, the Moderna vaccination. It's important to note that you wouldn't ordinarily be given a choice as to which vaccination you are given. It depends on what stock they have at the vaccination centre on the particular day that you attend. And the vaccination centres don't have any control over what they receive. This is sent centrally from the NHS. The next step would be to talk you through the common vaccination side effects that you may experience. So typically this would include things like a temperature, a headache, pain in the arm at the site of the injection, and tiredness. These symptoms tend to last about 2 or 3 days and gradually settle. It is safe to take things like paracetamol if you feel you need to. If you do get any of these symptoms that last more than 2 to 3 days or are very severe, such as a bad headache that's lasting more than 4 days, it's important that you discuss this with your GP, or alternatively call 111 for advice. So once they've entered all of your details onto the computer and they've said it's absolutely fine to go ahead with the vaccination, they'll then draw up the vaccination in front of you from a multi-dose vial and administer this into your upper arm. Most people choose to go with their non-dominant hand. For example, if you're right-handed, it would go in your left arm, and that's just because it can be a bit painful in your arm, a bit stiff the next day. After this, you'll be asked to take a seat for up to 15 minutes, mostly if you've taken the Pfizer vaccination, not necessarily if you've had the AstraZeneca. And this is just to check in case you have any immediate allergic reactions. After this, you'll be invited for your second dose of your vaccination in about 10 to 12 weeks, and this might be scheduled later. It is important that you still stick to the government-mandated restrictions, such as wearing the face mask and the social distancing. Having the vaccination does not exempt you from doing those things just yet. And that's pretty much it. So that's my experience of working in a vaccination centre and also the patient journey. And as you can tell, it's pretty efficient and you'll be out of there in no time. And hopefully we'll all be able to get back to normal pretty soon once we've all been vaccinated, which looks to be in the next few months. So that's it for today. I hope you enjoyed the video and found it useful. Let me know what you think in the comments. I'm also very happy for you to contact me on Instagram if you do have any questions about the vaccine. It's really important that we encourage all of our family and friends to take the vaccination when it is offered to you. I'll see you next time. See ya!